वक्रतुण्ड महाकाय सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा.
Good evening, everybody. A very, very warm welcome to you, my dear trailblazers. The World Heart Days falls on 29th September, but we are celebrating it today with a seminar which is going to be very, very apt and which looks very, very logical in the circumstances where nothing is more important than health itself. When we were planning our district projects, we thought that we have to give importance to education and health and environment. And what a moment we planned that, because COVID came in between and it looks right now. Personally, this is a very, very important project for me because I have benefited vastly from our district project Ek Chamach Kam Char Kadam Aage. To inaugurate this very important seminar, we have the National Committee member of Project Positive Health, PDG, Dr. Ravi Appaji. On behalf of all of us present here, I would like to welcome Dr. Ravi Appaji.
Thank you, Randy.
Today we have two luminaries in the field of medicine to talk to us. To get to the consultation room with them is very, very difficult. They are so busy. Dr. Hamsraj Alwa is a neighbor of mine, but whenever I pass through the lane, I get to see even at 12 o'clock, people are waiting for Dr. Hamsraj Alwa, and Dr. Manjunath is also very, very close to us. And I have been to his house for a breakfast one day. So nice to have you both with us. The Rotary Club of Puttur Elite is the newest club in the district, and it's very, very vibrant. They have already released 12 videos. They were chartered, or the charter presentation was on June 30th. They have already released 12 videos, one on 12 videos on COVID Teachers Day, on BV Karant, on the World Ozone Day, Literacy, World Bamboo Day, Bamboo Songs, and the Engineers Day. The newest initiative of them is on the district project Ek Chamach Kam Char Kadam Aage, and the song goes like this. It says Ek Chamach Kam Ka Chamatkar, and I would like to recognize the Rotary Elite member, Rotarian Maunesh Vishwakarma, who has to the credit the lyrics and the direction of this song. And he is, by the way, he's a press reporter, Kavana writer, short film and skit director. And the beautiful voice belongs to the son of a Rotarian, the Ishwar Bedekar. And this is Maunesh Vishwakarma. And the voice belongs to Satvik Bedekar, who is an exponent of the Carnatic classical music. And and to the credit of this video, the person behind the video goes to our district secretary projects, Rotarian Oscar Anand. We are very, very proud, and I now request our past governor, Dr. Ravi Appaji, to formally release this video, which we hope to make viral.
Yes. I'm very happy that you're coming out with a video song. Congratulate Satvik and Maunesh for the lyrics. And I'm very eager to hear that song. And it's a very good way of promoting this project. I am very happy to inaugurate this video song.
एक चम्मच कम 4 कदम आगे हमारा रोटरी कहता है सबको। एक चम्मच कम 4 कदम आगे हमारा रोटरी कहता है सबको। इसे पालन करना चाहिए हम सब, इसे पालन करना चाहिए। एक चम्मच कम 4 कदम आगे हमारा रोटरी कहता है सबको। ಒಂದು ಚಮಚ ಸಕ್ಕರೆ ಕಡಿಮೆ ಮಾಡಿ ನಿಮ್ಮ ಆರೋಗ್ಯವನ್ನು ನೀವೇ ಕಾಪಾಡಿ। ಒಂದು ಚಮಚ ಎಣ್ಣೆಯನ್ನು ಬಿಟ್ಟರೇನು ಆಗದು, ಆರೋಗ್ಯವ ಕಾಪಾಡಲು ಗಟ್ಟಿ ಮನಸ್ಸು ಮಾಡಬೇಕು। ಒಂದು ಚಮಚ ಉಪ್ಪನ್ನು ಬಿಟ್ಟರೇನು ತಪ್ಪಲ್ಲ, ನೀವು ಕಡಿಮೆ ತಿಂದರೆ ಉಪ್ಪು ಬರದು ಬೇಗ ನಿಮಗೆ ಮುಪ್ಪು। ನೀವು ಕಡಿಮೆ ತಿಂದರೆ ಉಪ್ಪು ಬರದು ಬೇಗ ನಿಮಗೆ ಮುಪ್ಪು। एक चम्मच कम 4 कदम आगे हमारा रोटरी कहता है सबको। ಆರೋಗ್ಯಕ್ಕೆ ಓಟ ಬೇಕು, ಹಿತಮಿತ ಊಟ ಬೇಕು, ವೈದ್ಯರ ಪಾಠವದು ಬೇಕೇ ಬೇಕು। ಅರಿವಿಲ್ಲದೆ ಬರುತ್ತದೆ NCD ರೋಗಗಳು, ಹರಡದಂತ ರೋಗಗಳಿದು ಹುಟ್ಟುವುದೇ ನಿಮ್ಮಲ್ಲಿ। BP ಶುಗರು ಬೊಜ್ಜು ಸ್ಟ್ರೋಕು ಕ್ಯಾನ್ಸರ್ ಕಿಡ್ನಿ ರೋಗ, ಹೃದಯದ ರೋಗಗಳು ಬಂದೀತು ಎಚ್ಚರ, ಹೃದಯದ ರೋಗಗಳು ಬಂದೀತು ಎಚ್ಚರ। एक चम्मच कम 4 कदम आगे हमारा रोटरी कहता है सबको। इसे पालन करना चाहिए हम सब, इसे पालन करना चाहिए। ಆರೋಗ್ಯವ ಕಾಪಾಡಲು ಸಂಕಲ್ಪವ ಮಾಡಬೇಕು, ಆಹಾರದ ಶಿಸ್ತ ಜೊತೆಗೆ ವ್ಯಾಯಾಮವೂ ಇರಲೇಬೇಕು। ಆರೋಗ್ಯವ ರಕ್ಷಿಸುತ್ತ ನಮ್ಮ ನಾವು ಉಳಿಸುವ, ರೋಟರಿಯ ಕಾಳಜಿಯ ಎಲ್ಲರಿಗೂ ತಿಳಿಸುವ, ರೋಟರಿಯ ಕಾಳಜಿಯ ಎಲ್ಲರಿಗೂ ತಿಳಿಸುವ, ರೋಟರಿಯ ಕಾಳಜಿಯ ಎಲ್ಲರಿಗೂ ತಿಳಿಸುವ। एक चम्मच कम 4 कदम आगे हमारा रोटरी कहता है सबको। एक चम्मच कम 4 कदम आगे हमारा रोटरी कहता है सबको। इसे पालन करना चाहिए हम सब, इसे पालन करना चाहिए। एक चम्मच कम 4 कदम आगे हमारा रोटरी कहता है सबको। हमारा रोटरी कहता है सबको, हमारा रोटरी कहता है सबको।
Congratulations, Rotary Elite. What a wonderful video. What a wonderful video. Definitely, we will make this viral and see that people become more healthier. Dr. Ravi Appaji, for the next 10 minutes, we will be listening to your inaugural address.
District Governor Rangnath Bhatt, District Councillor Dr. Devdas Rai, District Advisor, First Governor Krishna Shetty, District Trainer Dr. Nagarjun, the District Governor-elect Ravindra Bhatt, District Governor nominee Prakash Karan, and the District Chairman Shivshankar Aita, who is here. And my good friends who are going to speak today, Dr. Manjunath and Dr. Hansraj Alva, Dr. Shivshankar Bhatt, who's the chairman for the particular project. And all the wonderful Rotarians of 3181, and I also see a lot of guests and friends who are here. Just yeah. And congratulate you for this particular event, that is the Project Positive Health, and that we are celebrating the World Health Day today, though it is on September 29th. And there are too many programs, but however, I think almost 100 people are here. And I'm very happy to say this World Heart Day, this is to be celebrated. And this is one of those days that we chose when last year, when this particular project of Project Positive Health was initiated by our Rotary International Director, Dr. Bharat Pandey. It was his brainchild. When he called me and asked me to be in the committee, I was thinking it was not very interesting those days. I was just thinking, what is this project all about? But however, being in the profession of medicine as an orthopedic surgeon over the years of almost 30 years and being in Rotary for more than 29 years now, I think this is a particular project which is gaining so much importance, especially these days when everyone is thinking of health as the primary thing now. And we are talking so much about Corona and COVID. We get every information as such. But just would like to remind everyone that all the other diseases, hypertension or diabetes or any other disease, has not gone on a vacation. It's always there. And I think these diseases should not be neglected. And in this particular project, I'll very briefly tell you, in this particular project, what we thought was to include the diabetes as such, the hypertension, stroke, and the renal failures and renal problems as NCDs, though there are many other NCDs also. Then the immunization was included, and of course, HPV vaccination was included this particular year. So what we are just trying to do in this project is to tell the people that you need to know the numbers. So like, I need to know my height, I need to know my weight, and then the body mass index. And it should be less than 23 for a woman or a female, and then less than 25 for a man. And you need to know the random blood sugar, which should be less than 140, and the blood pressure should be less than 140 by 190. And these are the things, the basic numbers that we should know. Because why I'm giving so much stress on this is the incidence of diabetes, the hypertension worldwide is quite alarming. The more than 35,000 to 40,000 in Indian population out of 130 crore of people, we have almost more than 35 to 40 crores of people going through this problem of diabetes. And there may be many more who have not been identified yet. And that is the reason I think we need to make people aware that these particular numbers are very, very important. And that is the reason this particular slogan of Ek Chamach Kam and Char Kadam Aage. That is the slogan that is coined. One chamach less, and that's a beautiful song, the video song. I must congratulate the Puttur Light Club and Satvik and Monish for that wonderful song. I'm sure it is going to go viral. And I must also congratulate Rangnath Bhatt for having taken this as a district project. I think he's the only governor who has taken up this as along with the national the project as a district project also. 1 spoon of salt less, 1 spoon less of oil, and 1 spoon less of sugar. This is the project. Ek chamach kam and char kadam aage. That is to create more physical activity, the exercises that we need to do, and that is the awareness that we need to create amongst the people. Of course, last year we had a lot of these camps. Mammoth camps were held with 10,000 people, 15,000 people all over in various parts of the country during those days. And especially these 4 dates that you must remember is September 29th, and then November 14th is a diabetic day. And then we have February 23rd as the Rotary Day itself. And then April 7th as the World Health Day. And these are the 4 pan-India days to make it a uniform project all over the country, like how we initiated the activity in polio. It started almost in 1985, and I still remember the end polio push was there in 2005, but still, even today in 2020, we have 2 more countries left out in polio. But this is a persistent effort that we need to do. It doesn't happen next year, just we have a project 1 year, and that doesn't mean it will come down next year. So if we can, over the years of 10 years or 20 years, we may be there, in future also. This project, if we make an impact today, and with the initiative of Rotary, and we are also partnered with people of Indian Medical Association, the Arogya group, there is Apollo Hospitals involved in this. We have partnership, and we are welcome to more other project partnerships also here. The doctors, the medical fraternity today is facing a very challenging situation. You all know the COVID. There are so many doctors who have given away their lives fighting this corona, but still there is a mistrust. There is a misunderstanding. Even today, we do not know, because see, even in Rotary, if one person does a mistake, that doesn't mean you create a false name for Rotary International. So similarly, even in a medical profession, there are some things going wrong. There is good and bad in every field. And similarly, it has happened. There's so much of distrust, so much of misunderstandings about even corona, to do a test or not to do a test, whether it's a racket going on, whether people are unnecessarily being charged. And these are the issues that we need to face as doctors. As see, when we joined the medical profession, when I joined medical profession, I got an engineering seat, but still with the passion that we entered the profession, we can't just give up the profession. Our children today, people do not want to enter medicine. So there is a need for us to make it clear to the people and to create that awareness amongst the people that there are genuine things happening. So we need to tell the right things. I'm sure Dr. Manjunath sitting here and Dr. Hansraj, who is a couple of years younger to me, in the college, I know him that time also. I'm sure the doctors will take this opportunity to tell the public, to tell the people, and this particular program, the panel discussion, should be understanding and to reach everyone in such a way that we create a lot of positivity amongst people around us. So see, even in the challenging times, I always believe that we need to create, that is our social responsibility that we have for the community. And we are fortunate that we are doctors. I'm telling most of the doctors sitting here. And I remember when a father mosquito was sending the baby mosquito out for the first flight, the baby mosquito went round, it seems, and then it came back. So the father mosquito asked the baby, how was your first flight? And the baby mosquito said, everybody was clapping for me, and it was so happy. So that is the sort of positivity we must see in every activity that we do today. And I think this particular program, I think Rangnath, I must congratulate under your leadership in our district. It has taken up very well. Even in the morning, we had the session with 3190. The 3182 also is having a very good session on 29th. And there is a lot of information that we need to impart to our own people. And I'm sure this particular project will take off very well. And let us listen to our learned cardiologist. I'm an orthopedic surgeon. I do not know much about Hansraj. Don't keep laughing there. I do not know much about hypertension, or it is for you to tell the people how well that they have to protect their heart. And heart has a lot of idioms. Somebody stole the heart. Somebody has a heart for heart. And I do not know how Hansraj will explain the heart to people, and wish you all the best, and let us have a wonderful session today. Thank you very much.
Thank you, sir. Thank you very much. With your encouragement, we'll definitely do a lot of activities during the year. Thank you very much once again. And now I request Dr. Shiv Shankar Bhatt to take over the proceedings.
Good evening, everyone. Today we have two eminent personalities here to talk about the cardiac problems. The first person is a leading physician from coastal Karnataka and also serving for the coastal Kerala. And he is the director of Vinaya Hospital and Research Center. He is a very active Rotarian, our own member of Rotary Club of Mangalore Sunrise. It's none other than Dr. Hansraj Alva. It's a very friendly person. He's very busy, as our DG told. His clinics goes up to evening 11 o'clock, 12 o'clock in the night. And he's been a great corona warrior as well. And Vinaya Hospital is packed with corona patients now. You can see how carefully he is taking care of the patients and taking care of himself and his family. Excellent job from Dr. Hansraj Alva. He's been a busy practitioner also. I am very proud of him because he's been an entrepreneur as well. From practice, he has developed into an entrepreneur by taking over Vinaya Hospital, which was otherwise would have been closed. And he has given job to many people. Not only saving patients, he has given job to people like me. And he's a family man too. He is extensively traveled, very good friend of mine. People say you remember things you care about. And Dr. Hamsraja Alwa can remember years together about his patients' name, relatives. I wonder how. But probably he cares them more than everyone else. Over to you, Dr. Hamsraja Alwa.
Well, thanks a lot, Shiv, for a wonderful introduction. And I wouldn't like to waste time because we are, I think, running short of time already. I'll start off straight away about hypertension. Good evening, everybody. Today I'll be talking about hypertension, the causes, the management, the complications, and the treatment in a very brief manner, where I would kind of talk in a layman's term where everybody understands what is hypertension, what is the need for control of hypertension, what is the need for identifying early hypertension and managing the hypertension well so we prevent the complications of hypertension. As you know, hypertension is one of the commonest non-communicable disease. About 20% of the world population has hypertension. The prevalence goes up with age. Approximately 50% of all 60-year-old fellows have hypertension. Risk is less among women in a premenopausal age, but once they attain menopause, they are as vulnerable for hypertension as the male. The estimated 1 billion people worldwide have hypertension, and the risk is doubled by every increment of 20 by 10 mm of mercury. This is about the stats. What is hypertension? Hypertension is nothing but the resistance offered by the artery to the blood flow, in simple words. Next. So what is systolic hypertension? What is diastolic hypertension? I wouldn't like to go much into this. Systolic hypertension is the pressure exerted by the pump contraction of the heart. Diastolic blood pressure, which is by the relaxation of the heart in between the heartbeats. Whenever you come to hypertension, you have, what is hypertension, by the way? Hypertension is whenever somebody has a persistently elevated pressure of more than 140 systolic and diastolic more than 90, we taken at two different settings at two different times under a very ideal circumstances qualifies to be termed as hypertension. I wouldn't like to go into the details. So whenever you have hypertension, we have two types of hypertension. One is called the primary hypertension or essential hypertension or idiopathic hypertension. That's the commonest type of hypertension we get to see. That's about 85 to 90% of the people have primary or essential hypertension. It's usually seen in the age group of 40 plus, but it can be seen in the younger group, but seldom seen in a very young group. Whenever somebody with the less than age of 20 comes with hypertension, you have to screen them for secondary hypertension. So what is secondary hypertension? As I mentioned, secondary hypertension, even though it is a small number, but it causes vast problems. So you would like to, whenever a patient comes with hypertension, especially a young hypertensive, he needs to be screened for secondary hypertension. It could be because of OSA, it could be because of the problem in the kidneys, it could be chronic glomerulonephritis, it could be a polycystic disease of the kidney, it could be renal artery stenosis, adrenal gland tumors, thyroid problems, hypothyroidism, certain defects inborn, congenital blood vessels like coarctation of aorta, etc. Even certain drugs can cause hypertension, especially something you feel very, very innocuous, something like your painkillers like brufen, naproxen, or even antihistaminics, the drugs nasal decongestant, which we use over the counter. You just put the pharmacy fellow will just give you something to eat. Pseudoephedrine is one of the commonest drug misprescribed. You take it. It's one of those drug which can cause hypertension. Even caffeine itself can cause hypertension. And certain drugs we use for weight loss, and certain drugs like we use as the energy boosters, like here are. So some of those energy booster drugs, they also contains even corticosteroids can cause hypertension. So there are lots of drugs which can cause hypertension, which can be avoided. I'll come to that a little later. Am I audible? Essential hypertension. Okay, thank you. Thank you. I already mentioned about essential hypertension. I also already mentioned about secondary hypertension. I'll go further now. See, whenever somebody has hypertension, the reason for hypertension could be, I'm talking about primary hypertension. As I said, about 90% of the cases, we have primary hypertension, and in the mass, we generally take care of people with primary hypertension. So most of the times, it is genetic that runs in the family. Hypertension runs in the family. Age, as I said, as your age advances, your risk of hypertension becomes more. Because the blood vessel starts becoming more brittle. The resistance offered by the blood vessels increases. The so-called atherosclerosis sets in. I wouldn't like to go in detail into renin-angiotensin system. Diabetes is another disease which makes you vulnerable to have hypertension because of the vascular changes that diabetes brings. Certain modifiable causes like obesity is definitely one of the causes for obstructive sleep apnea as well as for hypertension. Salt intake, especially excess salt intake, is a cause. Lack of exercise. This is one thing we noticed in especially the software consultants who are already software engineers, software people who work in software who are sitting glued to their chair. They're half the time spending time on the computer, and they're highly stressed because they are given a particular job which they have to finish by X number of hours. They work late nights. They work according to the US timings. They hardly have any sleep. So they have no time for exercise. So there's lack of exercise, lack of sleep, stress, everything combined together, and they can keep smoking to keep themselves awake, keep drinking coffee or tea, which contains caffeine. That again brings the BP up. And finally, at the end of the day, gets fed up and starts drinking alcohol. So that again will contribute to hypertension. So the lifestyle is one of the most important cause for hypertension, especially in the younger generation we are getting to see now. So what are the signs and symptoms of hypertension? So, unfortunately, we hardly get to see anybody coming with some classical signs and hypertension to our clinic. Most of the people are asymptomatic people who just come for a routine examination to a hospital, and then they are found to be hypertensive. As high as about 40% of the people are asymptomatic. They come with no symptoms at all, come on a routine examination, found to be hypertensive. There may be some people who come to the hospital and maybe for the first time, and whenever they see the doctor, their BP shoots up. That we call it as a white coat hypertension, but that's a very small number there. So what are the signs of hypertension? On a small population, we come across. The people complain of fainting episodes, dizziness, irregular heartbeats, fatigability, headache, nausea, vomiting. These are the symptoms usually people come with. But most of the times, hypertension is diagnosed on a routine examination. Unless they come, a lot of these people come already with a complication of hypertension when they come to our hospital. Either they can have a cardiac disease or a renal disease or a problem in the eye. A lot of these people come with epistaxis, that nasal bleeding. These are the kind of presentations we get to see in people with hypertension. So what happens with hypertension? See, most of the times what happens with hypertension is when a patient is told that he's hypertensive, he is reluctant to take treatment. One of the most, because when somebody is branded as an hypertensive, he knows he has to take his medicines lifelong, which is not acceptable for any patient. We'll try to look for an alternative, either to skip the medicines or go for an alternative medicines, go for Ayurveda, go for homeopathy. He will not do any lifestyle changes, but he'll look for an easy alternative. And once the pressure comes back to normal, he decides to stop the medication. And the BP normal, this is exactly what he says. hope I drop in a couple of words of Tulu. I think people will understand that. What happens? Why we have to be worried about hypertension? So hypertension is a very lethal disease. As I just mentioned, 1 million people die every year because of hypertension. 1 million is a huge number. So why do they die? Because they die due to the complications of hypertension. Hypertension virtually affects every organ of your body, primarily the brain, the heart, the kidney. And what happens to the heart? I'm not to speak more about it. I wouldn't like to talk too much about the heart, even though it's pretty close to my heart. But he is better equipped to talk about the heart. Primarily, what happens is the heart enlarges because of constant pressure it has to work against. So what they get initially, what you call is the left ventricular hypertrophy. Then the left ventricle fails. They get it, the breathlessness and all pulmonary edema and those kind of complications. They can have heart attacks, they can have heart failures, they can have irregular heartbeats, what we call it, cardiac arrhythmias. So this is what happens with the heart. What happens to the brain? Sudden acceleration of the brain, they can have what is called as a hypertensive encephalopathy. The pressure goes up very high. The blood vessels supplying the brain can give way. Because of the rush of blood that results in intracerebral hemorrhage, bleeding into the brain, or a subarachnoid hemorrhage, which can be life-threatening. Or else sometimes they can have these infarcts. They can also have progressive loss of cognitive function. They become dull as days go by. The early dementia the hypertension is one of the causes for early dementia. Coming to the eyes, what happens? The hypertension affects the retina. They develop what is called as a hypertensive retinopathy. So other than that, they can have retinal detachments, they can have bleeding into the vitreous, vitreous hemorrhage, finally causing blindness. One of the important causes, treatable causes of blindness is hypertension. Adequate control of hypertension will save your eyes as well. Coming to the kidneys, kidney disease, both is true. The kidney disease can cause hypertension, or the hypertension can cause kidney disease, the other way. The chronic hypertension in kidney disease can happen because of kidneys start, it could be because of ischemic changes, where the kidneys shrink because of blood supply to the kidney is hampered. The second thing is they get what is called as chronic nephrosclerosis. So the kidney starts failing unless if you detect the failure of the kidney early and bring down the BP much lower than the normal population, where usually we would like to keep the normal BP at around 140/90 in a normal person. But a patient with a kidney disease would like to have his BP as low as around 120/80. So that's why you preserve the kidney. So otherwise they may end up with end-stage renal disease, end up with dialysis, life becomes hell. One thing that will make everybody interested is sexual dysfunction that hypertension has caused. Anything else is okay. When a young hypertensive, he is told that whenever he has an erectile dysfunction, the reason for that is hypertension, he will take more extra caution about it because that's where it hits him hard. So erectile dysfunctions are known in hypertensive people because of impaired blood supply. So I remember one of those ads where one of those fellows who goes to buy a packet of cigarette, and in the cigarette this thing, it is written, cigarette smoking is injurious to the heart. It can cause cancer and all those things. In one of those cigarette packets, it's also written, cigarette smoking can cause impotence. So he goes back and returns the cigarette packet and says, "Mujhe ye nahi chahiye mujhe." So impotence is something that hurts somebody. So sexual dysfunction is something will make the people more aware of taking their antihypertensives daily. That's what I think. Next slide. So as I said, how do you manage hypertension? See, management, you leave it to us. Drug management, we will handle it well. Lifestyle modification is very important. See, the lifestyle management, when it comes to lifestyle management, primarily it's the diet. Our diet is, most of these people are into fast food and, they hardly have any fruits, vegetables, more of meat and unsaturated fatty acids. So what diet, we in hypertension follow what is called as a DASH diet. So where the food is primarily vegetarian, lot of vegetables, fruits, and low-fat dairy products, grains, nuts. This is what we suggest people to have if they are hypertensive. Reduce your salt intake. Maximum salt intake should be around 6 grams per day. Reduce your sugar. Try to reduce your weight. The weight is a huge problem. You know, obesity is the biggest problem causing hypertension or diabetes. So disease modifying is very important. So you go on a diet, do regular exercise, take less salt, relax yourself. Relaxation is a must. Either you listen to music or do what you want, you know, or do what you enjoy. You may go into the farm, play with the animals. Everything is a healer, you know, or you just do some yoga, meditation. There are some doctors who are into rational medicines who don't really believe that yoga or meditation is going to bring down the BP. They're strongly against this concept, but I would like to bring it, but do whatever makes you happy. Be happy at the end of the day. That's what matters. That brings the BP down also. When you're happy, your BP is down. Stop smoking. Cessation of smoking is definitely needed, because smoking, nicotine is one of the important cause for hypertension. So stop smoking. And another set of people who will be very interested in my talk are the ones who once in a while indulge in alcohol. So that's why I never said stop alcohol, reduce the intake of alcohol. So if you are reducing, how much you are supposed to reduce? That's the question everybody is interested in. According to the British Heart Society, it allows you to have 2 drinks in a day. That 1 drink is about 30 ml, not the Patiala peg what everybody has. Whenever I say 2 drinks a day, the size does matter. 30 ml of this thing, 1 pint of beer or 100 ml of wine. This is permitted to have. That's about the management part of it. Medications, I wouldn't like to. Yeah, next. So I wouldn't like to really talk about these medicines because it's not really the need of the hour. But one thing, your doctor is the best judge what drug to be given to you. So you follow whatever medications been given by the drug, by the doctor. If you experience any of the side effects for these drugs, to your doctor. You know, don't make a decision on your now matra tinde kushna and matra unta. This is a common kind of this thing we come across. Everybody says that. Ushna, kapha, pitta. There's nothing of that sort in our medicines. The medicine may have side effect in the next one particular person, but that patient has to come back to his physician, discuss with him what exactly is happening with this medicine. Certain drugs, for example, we put them on Ramipril. It can cause cough, so dry cough. So, you know, so he comes and reports that we rule out the other causes of cough and maybe change the medication. He becomes all right. So this whole idea is not to be a doctor by yourself. Everybody is a Google doctor. We give a prescription, they go and search for the side effects of every particular drug. Trust your doctor, not the Google. Okay, we are better equipped. Each individual is different. So each need for medications also will be different. So you trust your doctor. Yes, even though I'm talking about hypertension, the management and everything, the need of the hour and which is giving us tension, we doctors, is people's inability to follow simple guidelines of preventing COVID. Everybody thinks COVID is gone. Nobody wears a mask. I never tried on from my clinic to home. 90% of the masks are in the neck or on the forehead. Hardly anybody covers their face. In fact, I wanted to talk in today's meeting with a mask on, just to have a message being carried home, you know, how important is it to wear the mask. So mask is a vaccine. We are waiting for a vaccine which is going to come, I don't know when, you know, and this vaccine is not going to help us. We are really not very sure how effective this vaccine is going to be, because these strains keep mutating. So it's not easy to develop a vaccine for COVID virus. We have to live with COVID. We have to live with COVID. But the most important thing is you wear a mask, do have social distancing. That is your immunity. Not eating arashina and those kind of kashaya and so many things at home. Everything is done. I've seen so many people coming with toxic effect of consuming too much of arachina. So, you know, they're having diarrhea, they're having so many other problems. So please, please, please maintain social distance. That is your pain immunity. Then keep washing your hands regularly. That is your medicine. Unfortunately, even for COVID, in spite of all the advances in the treatment of COVID we have had, our results with COVID is pretty disappointing. Maybe very early they come, and these antiviral drugs to an extent work in certain people. That's why we're not been able to save people, save everybody from COVID. We had about 421 doctors dying due to COVID. If the medicine is there, they would be the first one to receive those medicines. See, you understand the depth of this COVID is how much of a havoc this COVID is causing on us. So you maintain these three things: wear a mask, maintain social distance, wash your hands regularly. Finally, the carry home message. This is what is happening in my day-to-day practice today. People have become extremely restless. They have no trust in doctors. They have no trust in the system. Everybody thinks we do a COVID test and the test come positive. We have fixed the test. We have rigged the test. They don't want to, they don't have, whenever the bill comes, this is the, at the end of the day, everything has been displayed. The government itself has gives us the guidelines, how much we are supposed to charge per day, and all those things. In spite of that being mentioned, it's been already foretold to them. They still make noise. Life has become hell for them. Every day, I think I stopped checking my BP because I don't know how much would my BP be, because it's just not possible to work in these circumstances. So please, please, please take care of your doctors. Make them tension free. Understand the situation. We are going through a real difficult times. So with that carry-on message, take care of yourself. When you take care of yourself, you take care of us. Just maintain, wear a mask, maintain social distance, wash your hands regularly. That's the carry-home message, my dear friends. I'm done. Thank you very much.
We have another eminent personality here. He is Chief Interventional Cardiologist in AJ Hospital, Mangalore. And he is also Senior Professor and HOD in AJ Medical College. He is one of the early practitioners in Mangalore, coastal Karnataka, to start interventional cardiology. He is none other than Dr. Manjunath Bibi. He is he did his MBBS and MD from Mysore. In fact, he was my senior there. And then he went on to do DM cardiology in Manipal. And he's a good teacher. He is teaching the postgraduates, DM candidates. He is loved by his juniors, and he has got excellent interventional skills. He is known for his interventional skills, where opening up the blood vessels to the heart arteries. And he is very active academically as well. Every year he conducts a state-level cardiology conference in Mangalore, which is well received and attended by quite a lot of people. And he has many papers and publications to his name and credentials. Over to Dr. Manjunath. He is very fit and energetic. Even if I have told he is a senior professor, he doesn't look senior at all. Okay, he is fit and enthusiastic, very friendly, down to earth, approachable. Over to you, Dr. Manjunath.
Thank you, Shiv Shankar, for nice words. Am I audible?
Yes, you are, sir.
Yeah.
Yeah.
At the outset, I thank the office bearers of the Rotary Club for inviting me to share my views, and also Dr. Shiv Shankar for a few good words. Today happened to be 2 days before the World Heart Day, and my topic is made very easy by your beautiful video, because the video has told all the things which I wanted to tell. So I'll just elaborate on that, because you are told about one chamach kam, salt, oil, and sugar. So those things only I'll be highlighting. One Heart Day is celebrated every year on 29 September by World Heart Federation since 2000. So the idea of celebration of World Heart Day is that we have to, this is a non-communicable disease which is threatening the world, and every day it is increasing. For example, almost more than 17 million people die of heart diseases every year. So that means we have to educate, inspire, and motivate the people to keep their hearts healthy while encouraging them to be act as influencers themselves. So therefore, they should know by this what is the amount of disease pattern which is present all over the world. This year, World Heart Day has a theme. Every year they have a theme. They keep changing it. Use heart to beat a heart disease. That means use your head, use your influence, use your compassion, because this year they are focusing on COVID. And as you know that Dr. Hansraj has beautifully slides. He has summarized in such a way that we have to be very serious about this disease. And also I like to highlight that 60% or 60 to 70% of the patients who die of COVID are dying because of the heart complications. So we should be very careful and don't take it very easily. And therefore, we have to be, compassion should be there, and we should also take care of our heart. Let us begin. So where is the heart? How to look after the heart? It is inside the, it is in our hands only. And we lost the great luminary, music luminary, Shri S.P. Balasubramaniam, my favorite, because of COVID. And we pray for his. Now the question comes is, how about the cardiovascular diseases? By the time I finish this sentence, every 33 seconds, one life we are losing it. And more than 1.6 million people are affected in India due to heart disease. And we have a very high prevalence of heart disease, almost around 12 to 14% of the population. So the question comes is, India has become a world capital for two things. One is heart disease, another one is diabetes. So what is the reason why the mortality rate of heart disease has increased by more than 100% when compared from 1985 to 2020? And there is another important problem we are facing is 30 to 35% of male as well as female deaths occur due to the heart diseases. Now, when we have a special things to know as Indians. As Indians, we ourselves are at risk. So when compared to other population of the world, 20 times higher than Japanese, we have higher incidence, 6 times higher than Chinese, and 4 times higher than American whites. That means to say that we have a very increased incidence of heart diseases and deaths. Now, other things is I want to highlight is the age of a person. We say that we are actually, there is something called cardiac age. So cardiac age is different from the natural age. That means we are 10 years older than the other population. That means to say that the heart diseases are setting at about 10 years younger than population compared to the other part of the world. So we have a tremendous problem of young people dying of heart diseases. What is the reason? There's so many reasons have been said that we have, as a country, we have become economically progressive. As you know that except for this COVID time where our GDP is less, otherwise we have become from a poor country to developing almost towards the developed country. Because of that, the lifestyle changes occurred towards the Western. Food habits have changed. A lot of junk foods we are eating. Apart from that, something like that, we are genetically prone. So that I am going to highlight about it. And we have very highest incidence of diabetes and smoking. Now coming to the risk factors. So most of the risk factors are known to us. Today I am highlighting about the newer emerging risk factors. Now something is modifiable, which is called, which is in our hands to modify the risk factor to reduce the heart disease. But some of them are called non-modifiable risk factors, like genetic inheritance. This is a very important point because when you call that somebody has got a genetically prone heart disease, that means in your family, if somebody is having heart disease, which is proved by the procedures or by the evidence below 50 years of age, that means the heart disease has precociously onset has occurred in that family. So somebody gives a history of that they have a family history of heart disease within 50 years of age. So there may be heart attacks or even the deaths. So in this group of people, we have to be very careful because they may not have any symptoms and suddenly the sudden cardiac death may be the first symptom. So those who give that type of history, what we do is we investigate them despite they don't have any symptoms. Other things are modifiable risk factors, which everybody knows is like smoking, hypertension. Dr. Hansraj has beautifully highlighted the causes and effect of it, diabetes, cholesterol, and obesity. All these things are very well known fact. So what are the new emerging risk factors? This is very important. Psychosocial factors are very important. Dr. Hansraj was telling about the software people, their food habits, and getting up in the late evening and working according to the US times. These are all it causes a lot of psychosocial factors which causes extreme stress. Therefore, there will be some emotional exhaustion, depersonalizations, and particularly we physicians have what is called as physicians burnout. We have to be very, very careful because we are also not protected. We are like other human beings. We are also equally prone for risk. Other environmental factors are air pollution, which I'm going to highlight a little, sleep deprivation, and sitting disease. This is very important because most of the people, we go for work and sit there for 6 to 8 hours and come home and sit in front of TV. Again, it is a sitting disease. So sitting disease itself is a risk for heart. And being a South Indian is not South Asian, sorry, South Asian is a risk because the people of South Asian descent, all the India, Pakistan, all these people, we have higher risk of atherosclerotic heart diseases. We have 4-fold increase. And also not only that, even if we do an angiogram and find out the coronary artery size, inherently the Indians, we have small size coronary arteries. So there was a study called Masala study. This study was done in US. And the study was done on the Indians of the Americans of Indian origin who have migrated to US. And they have done, and they found that in this Masala study, that is mediators of atherosclerosis in South Asians living in America, they found that when compared to the local American white people, we are more prone for the heart diseases and the complications of it. And in fact, the treatment when they do it, either an angioplasty or surgery, even the complications and follow-up also is likely to be not very encouraging because we have small lumens diameter and we have higher grades of blocks and also multiple vessels are being involved. So therefore, as such, as I say, South Asians, we are at increased risk. Sleep, very important point. Sleep is one of the 4 pillars of good health. So therefore, sleep is very important and too much sleep or too little sleep also is associated with increased risk of heart attack as evidenced by recent journals. So the question comes is the air pollution. Now, of course, this is not in our hand. As you know, the air pollution has become a major risk factor, not only for heart attack, for stroke, even the clot formation events, arrhythmias of heart, heart failure, sudden death, infertility, cancer. All these things have increased incidence because of the air pollution. There was a recent study last year in Jayadeva Institute. They did almost 2,400 patients in Bangalore. They have done a study. They found that below 40 years of age, most of these patients, even below 30 years of age, 25% were proved coronary artery disease. So they had heart attack, they were treated. And they found that not only the rural population also are equally prone compared to urban, although the urban population has more prone. But the other reason is even the lower socioeconomic group of patients like drivers, they are also prone for it. So all of them are equally exposed. Smoking, a few words about smoking. Each cigarette reduces the lifespan by 4 minutes. Please, any of you are a smoker, please stop smoking not only from today, but you should think of, because if you stop smoking from today, you will become normal only after 10 years. That is how the smoking has its bad effect. It increases heart attack by 3 folds. increases heart attack, not only heart attack, stroke, and peripheral artery disease, and therefore also it increases the incidence of cancers of lung and stomach. Now, it has a lot of side effects, as you know, that increased risk of heart disease, cancer, which I have already told about it. So it doubles the risk of stroke also. Hypertension, I don't want to go to details. Already Dr. Hansraj has in detail, he has explained. The other thing is that the insulin, yes, insulin resistance and diabetes, we have become almost the capital of the world. So because of diabetes, there is 3 to 5-fold increase of heart attacks. Most of the diabetic, when we do an angiogram, we find that their vessels are small. They have increased incidence of stenosis, that is the narrowing of the arteries because of the cholesterol accumulation. And most of them will have also the cholesterol abnormalities, which is also highlighted. So it is a total environmental, it is the heart diseases are due to multiple factors, environmental factors, metabolic factors, disease as such, and the lifestyle also makes it more complicated. Now, this is how when you take the arteries where there is a cholesterol block and cholesterol block has ruptured, causing a clot inside. This looks like it's a cut process of how the plaque ruptures. Now, this is, I can compare to this is an American diet. This is called burrito. Burrito, if you have visited US, then you ask for a burrito, it looks like this. The burrito will have a meat inside, which looks like a reddish, like a clot, and surrounded mayonnaise, then the cheese, everything. It is a wrapped up. So it looks like what I normally say is a burrito looks like a cut coronary arteries. So this is how the same thing gets accumulated inside the arteries, which ruptures to cause a heart attack. What happens is our cholesterol start accumulating in the heart vessels or cells of the body from 9th year of age. That is very young age, 9th year. For some people, the accumulation of cholesterol start increasing and further and causing a heart attack or stroke. Now, the other question comes is, this is how the heart attack occurs because the cholesterol which was accumulated in the arteries starts, when it ruptures, it causes clot formation, occluding the artery completely, lumen, and causes the heart attack. So we have treated a lot of patients from 2002 onwards. I'm in AJ Hospital for almost 18 years. And I'm almost done some 28,000 angiograms till now from 1989 onwards. I have found a lot of patients who are young people who we cannot even imagine the amount of disease they have. You can see the block here. It's a young lady of 32 years. When we did an angiogram, so she has got such a high degree of blocks here also. All the 3 vessels were showing blocks, which suggests that despite women are not protected as we think, women are protected by God when they in their menstrual cycle is during the menstruation, that is from 15 years to till they get past 45 years. But during this period, women are protected only if they are not having additional risk factors like diabetes. If they have diabetes and other cholesterol accumulation and other risk factors, they are equally effective compared to the men people. And the important other thing which I want to tell about, already Dr. Hansraj has told about obesity. Very important point is we have to maintain ideal weight. How do you calculate? It goes by body mass index. And we know that our body mass index has to be kept on check. And how do you calculate ideal weight? Height in centimeter minus 100 into 0.9 is a formula which we follow. And BMI is overweight between 25 to 30, 30 to 35 obesity 1, obesity 2, obesity 3, and above 40 is obesity 3. Simply to say that in our general public, we say obesity has got 3 stages. This is a medically proved stages. They say lovable, laughable, and pitiable. So somebody is little obese, we say lovable. It looks lovable to have obesity. But when they become little more, it is laughable. And when their BMI goes above 40, it is a pitiable obesity. Now, coming to the what will happen in obese people? Obese people are prone for multiple disease. They are prone for diabetes. They have insulin resistance. They do not respond to the diabetic medications easily. They have increased incidence of heart disease because of the accumulation of cholesterol, heart failure, arrhythmias. Infertility is very important. Stroke, polycystic ovary disease, ovary syndrome in ladies. And also they are prone for higher incidence of carcinoma of reproductive system and colon. Of course, osteoarthritis of knees is very well-known factor. So therefore, is it genetic? Very important point. If as parent, if I am obese, will my children become obese? So American Diabetic Association says, if we have 2 obese parents, there is a 80% chance that siblings will be obese. If there's 1 obese patient, there's a 40% chance of sibling being obese. And non-obese parents, still there is a 10% chance of siblings being obese. And there's a very interesting study which has come. Most of the time for our children, if you say you keep doing exercise at younger age, they do not follow. But suppose if you have a child obesity and your whatever weight you have at the age of 18 and the percentage of weight gain during the next few years will be a track for subsequent risk of diabetes as well as heart disease. Now, tummy checks, very important. We have to waist circumference for men is less than 90 centimeter. Women is less than 80 centimeter. We have to keep a waist hip ratio also in check. Apart from that, exercise. According to me, there are only 2 things which we can achieve, because I told so many risk factors, but only 2 things can be done from our side. One is an exercise, another one is a diet. I feel that exercise can prevent many diseases. So what type of exercise we should do? Now, if you look at that, it's very easy to tell, but how many of us are physically active? That's very important. 60% of US population themselves don't engage in regular physical activity. So, but when we are physically active, you maintain your body weight or waist hip ratio. It improves the cardiovascular risk factors because it reduces the onset of diabetes. That's the one thing which some people will ask me, how can we prevent a diabetic to occur? Yes, it can be prevented by following the diet and following a good exercise protocol. It reduces the onset of developing of diabetes, or those who are diabetic, it definitely improves the treatment aspect, and it reduces it is easy for us to maintain. Osteoporosis, obesity, cancers, and depressions are some of the things which will be tackled by the exercise. So ideally, basically, we should do isotonic exercise, as you know, brisk walking, swimming, aerobic, dancing, slow running, treadmill. These are all the things. Cycling are very well accepted mode of exercise. And we should try to avoid isometric exercise like weightlifting, but minimal weights should be done to keep our muscle tone. Daily walking, another important thing is you should walk 4 to 5 days a week. And brisk walking is very important. So that is 3 to 4 kilometers. Brisk walking will help. Put on a proper shoes, sports shoes, even level walking, no gradient, and on track suits or the one with good hydration before and after exercise is what is required. Now, types of exercise, phases of exercise, which most of us, we know that. So there is a American Heart Association statement. It says that non-diabetic individuals, weight loss and increased physical activity can delay or possibly prevent diabetes. And in those with diabetes, it decreases insulin resistance and improves glucose control. Coming to the diet, I have not much time to tell about the diet. Just to brief about it, we should know that we should have a balanced diet. That is called the American Heart Association statement, revision statement says that we should have a balanced calorie intake, diet rich in vegetables and fruits, choose whole grain, high fiber food, consume fish twice a week, but limit your intake of saturated fatty acids. And you have to use lean meats are preferable than the red meats, fat-free skim milk, and minimize the beverages. And about sugar, I'm going to give a little more details. And moderation in alcohol intake, which Dr. Hansraj has already told about it. The DASH diet is what we try to advise for the people. Fruits, vegetables, low-fat dairy products, skinless poultry, oily fish, nuts, and whole grains. This is the DASH diet. And a lot of fruits, and particularly diabetics should be very careful. They can eat fruit, but the quantity should be minimal. And so there are some fruits which I'll be highlighting about that. And dietary diet, avoid red meat, sweets, sugar-containing beverages, junk food, and bakery products, which are not good. So now you have a choice between an apple and a chocolate ice cream. So you have to think about it. Now, sugar is needed for human body? Absolutely no. Sugar has no nutrient value. It is only adding calories to us. And therefore, WHO says that sugar has no role as a part of healthy, balanced diet. So therefore, before, already in the video, they were telling 1 spoon less. According to me, if you can avoid sugar, that is totally good. And very little sugar if you want to take, you are allowed to take less than 3 spoons of total intake per day, provided you are not a diabetic. Now, there is something we should know that most of the food which we take for breakfast, cereals. See, for example, look at this. The amount of sugar which is present in various cereals. So breakfast, we try to say, take some cornflakes. We think that cornflakes doesn't have sugar. You take a plain cornflakes, it has got 2.5 spoon of sugar. So therefore, most of the sugars are hidden inside. So therefore, what happens is sugar releases massive dopamine, which is an addictive. So therefore, it leads to obesity, both in children and adults. Therefore, we should avoid particularly the sugar-sweetened beverages. So it's a perpetual cycle because you eat sugar, you like it, then dopamine gets released, you become hungry, and then again you start eating sugar. So you have type of the taste for it, which is very difficult to resist. So therefore, you have, and artificial sweetness, no artificial sweetness should be used because they in long term, they have bad effects. Therefore, when they say that you are diabetic, shall we use a artificial sweetener? You have to say no. You have to leave sugar completely. So other thing is about deep fry, avoiding deep fry, and sugar-free juices are preferable, and whole fruit is preferable. Now, these are the Mediterranean diet, which is very good. And there are some of the things which I like to highlight is the glycemic index. It's a very important slide, according to me. There is a misconception about what is glycemic index is the ability of food item to raise your blood sugar level. Now, it is not same for you. So, for example, people have wrong concept, but rice has more glycemic index. No, rice and wheat has got similar glycemic index. They think that we leave rice, we take chapatis. No, it is not the solution. Both rice and wheat has similar glycemic index. What about the baked potato and white bread has higher glycemic index than white rice and even corn. And if you want to take the fruits, some of the fruits like apple and orange have lower GI fruits. Therefore, in diabetics, we advise the one fruits which have lower GI, that is glycemic index, like apple, orange, and of course, honey has got a very high sugar because most of the patients think that if we leave sugar, we can add honey, which is also not correct. Then what is our goal? To reduce the heart diseases. As such, this is the ideal, to maintain ideal weight, BMI, and blood pressure, blood sugar, cholesterol, leaving smoking completely, and increase physical activity is a goal for it. Stress and heart, because in the Rotary, most of you are executives, and you should know that the high cardiac risk is basically in a type A personality. They are very agitated. They are stressed because of their workload. Long hours of under stress, self-rationalization is very important, and lack of time, erratic lifestyle, indifferent dietary habits, and lack of sleep. The other thing is that we should have a sound sleep, we say. You should not make sound when you are sleeping, that is snoring, which is a part of obstructive sleep apnea, which is detrimental to the heart as well as the body. So you have to have a sound sleep of 6 to 8 hours. So therefore, I feel that probably the relaxation response techniques like yoga, meditation are going to help us in long term. So what are the ways to relax? Enjoy music. Music is a very good tool for relaxation. You can hear the music, you can sing as well, and do gardening. Gardening is an extremely good relaxation. Reading book is an extremely good way of relaxation. So manage stress with so be in the family man, spend your time with family. It is also stress busters. So how do I know my heart is healthy? So there is American Heart Association has got simple 7 formula. Simple 7 ways to live better. Avoid smoking. Be physically active. Eat healthy, hard diet. Healthy weight has to be maintained. Keep your blood pressure intact, very control. Keep your total cholesterol healthy and keep your blood sugar healthy. This is the 7 simple ways of maintaining your heart according to American Heart Association. So my good health mantra is 4 pillars of good health. Good food, which is a balanced food. Good exercise, regular, moderate intensity. Good sleep, 6 to 8 hours of uninterrupted deep sleep. And good genes. You have to have strong genes inheritance. So 4G, and I have added a last G called God's blessings. So with this, I am very happy to take any of your queries which you have. Thank you, Dr. Shivshankar.
Thank you, Dr. Manjunath. What an excellent talk. It was the one we wanted, actually. We thought super specialist, chief cardiologist would be talking about heart and we wouldn't understand. But it was up to the grassroots level for everybody to understand. It was so easy and so good, so absorbing. And especially this is in our culture, the giving sweets, taking sweets. Somebody passes 10th exams in a high score, they'll be sweets. I think this is a culture. We have to change this culture of sweets. And
yes.
It has changed.
No, I think, Shivshankar, you made a good point, because our feeling like, suppose if you hand over fruits to somebody, they think that you are sick. Therefore, only sick people get fruits. But when you want to enjoy, you want to have sweet. It should be the other way around.
Yeah, it is the other. And I keep telling students, you don't just look like your parents. You just don't inherit their properties. It is important to know that we inherit their diseases as well, especially if there is some medical problems in a very young individuals that can be genetic. And that's again, the 4 pillars were also very good. The 4th pillar, genetic, we can't change. All other 3 pillars are in our hands: sleep, exercise, food. And for the 4th one, God's grace. If we have God's grace, we can win there. And we have few questions. Is Dr. Hamsraj Alwa is also?
Yes.
Yeah. Dr. Hamsraj Alwa, someone from Madikeri, some Rajani is asking a question about low blood pressure. Is a low blood pressure a problem? Because apparently they've been diagnosed with the low blood pressure.
Low blood pressure. Actually, low blood pressure is not a problem. Actually, you live longer, according to me.
Yeah.
So that much is, at least his heart will be better protected. But sometimes if you're asymptomatic, could be because of a lot of reasons. One of this condition like autoimmune neuropathies, they can cause low blood pressure, or somebody has, so low blood pressure is nothing to worry about it. So maybe little increase your salt intake, hydrate yourself well, wear stockings. So this should help you to control the BP if you are symptomatic. Otherwise, you can conveniently ignore and live happily ever after.
Yeah, and Mr. Rajshekhar from Mysore is asking that you have asked to reduce the blood salt, but apparently there is some problem in elderly with the low salt and sodium is going low and having problems. What is your advice on that?
No, that's exactly the point. We didn't say no salt diet. We said salt restricted diet. The intake of salt should be restricted to 6 grams per day. I'm not saying the salt-free diet. You have to have salt, but at a restricted. But again, those people, most of these people, elderly people who have the salt, hyponatremia, we call it, the low salt, is because of various reasons. One could be because of the drugs they use, maybe some antihypertensives, they're using some diuretics that is causing it. We have to look into that. The second thing is whenever they have an infection, they can have what is called as SIADH, where the sodium level goes down. There you have to restrict the fluid and find out the cause and treat it. So restricting the salt will not cause low sodium in a normal, healthy individual. Never.
Okay. And there's one more question. You said there is increase in the incidence of blood pressure in females. Why there is increase in? blood
No,
pressure?
actually,
Any
the
particular
blood pressure.
reason?
No, the blood pressure is less. Hypertension is less in young females. Once they attain menopause, they have the protection which is given by the hormones, which is lost, the estrogen, what they secrete. That may result in them turning hypertensive. I mean, their risk of hypertension equaling the men. As long as they're menstruating, they're protected by the hormones.
Yeah, yeah. Dr. Manjunath.
Yes.
Dr. Suresh Kamath from Mangalore, I think from Metro. He is Rotarian. He's asking a question about a silent heart attack. And why do diabetic, maybe someone had in his family, diabetics get it. What makes it silent? How do we know if diabetics develop silent attack? How do we know? Like if it is silent, how do we know they have developed, and what are the signs? That is his question.
Good question, actually. What happens in diabetics and also another group of elderly people, because of diabetic changes in the nerves, their pain threshold is very high. That means for smaller pains, they do not complain. They don't feel it. So when they develop an angina, what we call it is the pain due to the heart muscle crunching for blood oxygen, that type of pain is not felt by them. So therefore, they do not seek the medical assistance immediately. Yeah. So because of the diabetic changes, what we call it is autonomic changes in the heart vessels, as well as in elderly people also, because of the pain threshold. So they do not feel the pain. Therefore, they did not come and approach the doctors for. And therefore, sometimes when they come with a vague discomfort, we may not have a discomfort at all. When we do an ECG, we find that they already had a heart attack as shown in the ECG and the echocardiography. So this is called silent attack, which is very, in fact, it is not good, because if they have a pain, they come to the hospital, we treat them completely. Like, as you know, the heart attack mortality has come down less than 3% now. But when you know that when we attained independence in 1947, the 50% of people used to die of heart attack. The 50% mortality has been reduced to less than 3% now because of the medical interventions, the amount of research which has occurred, and the amount of technology which has developed. In this situation, now no heart attack patient should die as such, because if they approach the situation, approach the doctors.
How would they know that they have developed?
No, actually, that's what I told.
What are the other signs and symptoms?
If they do not have pain, they can have other signs like easy fatigability or some type of giddiness or some vomiting sensation. Some of the heart attack patients come with vomiting, suggestive of the gastritis like. So they have tiredness. Suddenly their blood pressure is very low compared to other days. So these are all some of the factors which they have to seek medical attention immediately, although they may not have chest pain.
Yeah. The same thing, even not only silent diabetes, even our GI as well. The diabetic patient's manifestation of pain can be absolutely different from others. And another thing, there is an overlap between gas trouble. People come to us sometimes as gas trouble, but they have the cardiac problems. Yes. And they go to cardiac problem with the chest pain. They might have an acute cholecystitis. Yes. But how do you, in general, differentiate gas trouble from cardiac trouble?
It is basically what happens is common people, they want to self-diagnose first. At the same time, they also think that they do not get heart problem, and they confine themselves with an idea that it is the gas trouble. Although the symptoms of gastritis and heart pain like angina may be same. Therefore, it is instead of self-diagnosing and confining themselves with their own diagnosis, it is better to do an ECG or meet a physician and clarify it, because gastritis is totally different way. If you don't treat it also, nothing will happen. But if a heart attack symptoms are similar to the gastritis which is not treated, it can lead to a mortality. Therefore, they should not do self-diagnosis. They should approach the physician.
To Dr. Hamsaraj Alva, Mr. Ravi Shankar from Puttur, he's asking, is a short temper is a sign of somebody developing blood pressure?
No, it's irritability is one of the features of hypertension. Could be. It could be the other way around also. You are one of the short-tempered fellow, you are more prone for hypertension.
Okay.
It can be other way around. So it could be, maybe the irritability, some hypertensives can be easily irritable. And people who are more irritable can develop hypertension also. It's like a vicious cycle.
Yeah. Okay. And Dr. Manjunath, you said the sleep is important. And what about the circadian rhythm? Like, are we interfering with our? Can we tell something about our circadian rhythm and how it is important? Like how we have to go to sleep early and wake up early? Is there a point in?
Very interesting question, Shivshankar. Now, sleep, we have to. There is a recent report which has come about 2 months back, an international report. This is telling about siesta. Siesta means that what we take sleep after the lunch in the afternoon. It is called siesta. Now, siesta also they have defined. This study has shown that somebody who is having a sleep in the afternoon after their lunch for more than 20 to 40 minutes is not going to be helpful to them. Okay. So that means you have to have a short nap, if at all, if you want to take it. In fact, that study has shown that those who have a short nap of 20 to 40 minutes, it is helpful to them. It is useful to them to reduce the incidence of heart diseases. However, if somebody sleep for more than 1 hour in the afternoon to take rest, it is not only not helpful, it is detrimental. That is about the siesta. Now coming to the night sleep, it is told that you have to have 6 to 8 hours of sleep. What time you sleep, how long you sleep doesn't matter. But you should have a deep sleep. That means you go to sleep uninterrupted and sleep for 6 to 8 hours. That is very helpful because more so in this pandemic area of COVID, how can you develop an immunity? This sleep itself is a good immunity. If you have a good sleep, in fact, there is a wrong concept also. There are people who get up very early, get up at 4 a.m. and go for exercise. In fact, they have reduced their sleep. Do you know one thing? If you have a good sleep, you have done almost 1 hour exercise. So it's equivalent to 1 hour exercise if you have a good sleep, uninterrupted sleep. Other important point is when you have a deep sleep uninterrupted, 6 hours to 8 hours is the total amount of sleep a man requires. However, the sleep pattern also changes as we grow old. We may not have the continuous 6 or 8 hours sleep in the night as we grow old. That is the accepted mode. However, there is another important point which I want to tell is that before 5 a.m., nobody should get up. That is what very, very clear. Because
what is that?
When you get up early morning, you should not get up before 5 a.m. There are multiple studies have shown people who are getting up earlier than 5 a.m. where very high incidence of platelet aggregation occurs during that period. The vascular events of stroke and myocardial infarction is very high between 3 a.m. to 5 a.m. So that means to say that you have to sleep, whatever time you sleep, please do not get up very early, number one. Ensure that you have 6 to 8 hours sleep and you have to get up only after 5 a.m. By the time the vascular events start reducing because of this. This is number one. Number two, another thing is that the siesta I have already told. The third thing that there are some patients, to add to Dr. Hansraj talk, there are patients who develop higher pressure, blood pressure when they are sleeping. And also they have a sudden surge of blood pressure in the early morning. So that cannot be recorded when they are sleeping. Therefore, nowadays we give a lot of importance to 24 hours BP monitoring, which will pick up those patients who get early surge of catecholamines, what we say. That means early morning, their blood pressure keeps going up. They will not be aware of it. Or there is a night drop is required. Blood pressure should drop in the night when they are sleeping. If it is not dropping, it is also very high risk for stroke and heart attack. So nowadays we give a lot of importance for those patients of how to treat this type of patient. These people can be treated in a different way when compared to the normal hypertensive treatment.
Yeah, even the sugar level goes up and down in the night. And is there a relation between the sugar level and the blood pressure?
I think that Hansraj can answer this.
Actually, yeah, sugar can. There's something called a Somayagi effect, but this usually the sugar goes down at around 3, somewhere around 3 o'clock in the night, and then the body compensates by releasing extra catecholamines that will artificially bring the sugar up.
Okay.
But in a non-diabetic, we are more worried about the diabetic people having this kind of an effect where the risk of hypoglycemia happening in the sleep can be detrimental. But a normal person, the sugar may go down, but it may not cause any damage to the patient. We are more concerned about people who are on treatment for diabetes and their sugar going up. That's why some of these patients, we take 7 samples of blood sugars, including a 3 a.m. sample, just to counter this problem of night hypoglycemia, patient going in for hypoglycemia during sleep.
Okay. Dr. Manjunath, there is a question from Walter Menages about the snoring. He wanted to ask about snoring. I think what he says is signs of snoring. I think maybe he means by what are the complications, or he said what is the sign of snoring, or what the snoring means to health. Probably that is the question.
Yes. I think a very good question. Basically, what happens is nobody wants to describe their sleep. So if you ask them, how do you sleep? I have a normal sleep. The sleep has to be described by the partner. That means either wife or husband. Because snoring is only identified by the persons who are sleeping next to you. Okay. Now what happens is, mild snoring is accepted, but what we normally do is we give a lot of importance to sleep nowadays because sleeping disorders have become a havoc. And because of sleeping disorders, the diabetes is increasing, the hypertension is increasing, and heart diseases and strokes are increasing. So we have a condition called sleep apnea syndrome. So obstructive sleep apnea, what happens is patient goes to sleep, person goes to sleep, and suddenly what happens is they start snoring, and the snoring increases in intensity, and they desaturate, that their oxygen level comes down, and it causes an obstruction totally. They have to get up. And some of them are snoring so much, it disturbs the partner. But partner thinks that is the normal activity. So therefore, unfortunately, they think it is normal. So basically what happened now, when patient come to the importance, we are giving a lot of importance to obstructive sleep apnea nowadays. So I asked them, if you ask the patient, they will say that I have a normal sleep, but you have to ask the wife whether he is snoring. She says, yes, he's snoring. Then you have to ask the pattern of snoring. And then we put them on sleep apnea, sleep studies. Sleep studies are there now. 6 to 8 years of our sleep studies are done. Probably that will give us idea about the desaturation, the heart rate response, the pulse, the pressures, as well as the pattern of what is called as the oxygen deficit which occurs during sleep. So very patient now, there is a separate department of sleep, as you know that.
Sleep specialists.
Sleep specialists. In USR, there are sleep specialists only. They look after only the sleep study and do this. And do you know one thing? There are a lot of patients who have this obstruction during sleep will get treated. Their diabetic level will become almost very well controlled. Their weight gain will control. Their cholesterol will come down. The chances of heart failure and heart attack comes down. So a simple treatment for sleep will make them happy. So therefore, it is a very important point. If somebody snores, do not neglect it.
Ignore it. Get it corrected.
Get it corrected. It can be easily corrected.
Thank both of you. It has been really, really exhilarating, nice discussion, nice topic. And we would like to invite you for in vivo sometime, both of you.
Oh, sure. We are ready.
Thank you.
Thank
sir.
you so much.
Thank you
we
so
had
much.
a great time. Really enjoyed the evening.
Thanks, Mr. Ranganath and Rajani and the team members who have coordinated this meeting. We are very happy to be part of this meeting. Thank you so much.
Thanks to the Rotary family. I appreciate that. Every one of you. Thank you so much. It's been a pleasure.
Thank you. Thank you very much, Dr. Shiv Shankar, for moderating this session. And thanks to Dr. Hansa Jalwa and Dr. Manjunath, who gave us a wonderful insight into this world of being healthy. Thank you very much. We will be actually, we will be posting this video on YouTube so that many more people will benefit from
it. It is really nice. Really, really nice. Worth watching again.
So thank you very much. I would say that this has been a Sunday well spent, as we have become wiser. And like Dr. Hansraj Alva said, let's put on our masks, maintain the social distancing, and wash our hands. Take care, everybody. Thank you for attending this program.